You've talked about hardwiring public engagement into the National Health Service. How do you do this? These are the fine-sounding words, but how does that come together in a way that, in a sense, tackles this very problem we're talking about? Because it's about the incentive to change, isn't it?
It is. And I think it's really very difficult. And it is easy words to say. And actually, this world of work is littered with easy words to say and very difficult things to deliver. I don't think there is a simple and easy route to doing it. I think that all aspects of the system need to be held to account, and that there is probably a number of different systems and processes which you need to establish at different points along the scale. Which mean that at every step, decision making has to reflect what it is about for the people who are receiving it. And I think in trying to achieve that, there are some real dangers about how you do that, and whether or not in trying to attempt to do that, you actually create a system which is, on the surface, very effective and very accountable and made up of lots of local people who are there to represent the view of the local community and to hold these people to account. But that in actual fact the reality is that that is a kind of soft soap. It's a people often use the phrases tick box exercise or tokenistic or a phrase that I really don't like, and they use the phrase the usual suspects. And really what they're trying to say is that these are systems which these organisations who maybe don't want to hear the critique of themselves personally, it's an easy way for them to create an image, a smoke and mirrors situation, where on the surface it appears to be that there are people here, they're taking part in the decision making, we've got a strategy full of lots of long words like empowerment and hardwiring and all those sorts of things, and so it looks like it's all kind of sewn up and that it's all working very beautifully and everybody's doing it together. I think the reality is that to really achieve public influence over decision making, you've got to be feeding real voices in all of the time. Not representative, distilled voices, but you've got to somehow try and find a way which brings those experiences and those voices to the tables at regular points.
Let me ask the question another way. If you had a hospital which had hardwired public engagement, how would it be different?
Let me think. I think if you had a hospital that had hardwired patient engagement, it would be a hospital which was truly owned by the community that it was serving. And that might, if anybody's thinking about it, it might make them think, oh, it's a foundation trust. A foundation trust has governors, and it is owned by the community, or that's the aspiration. But I don't think somehow that's quite hit the spot, because, for example, a foundation trust can hold its board meetings in private session. Its governors are elected from a fairly small number of people who happen to have the time, the inclination, the knowledge, the expertise to do that. They then create a public membership that they talk about as being a way to create a kind of constitutional basis on which they can make their decisions, and that the membership is really those who are potential users and current users of its service sharing in the ownership. I don't know if that model really works. I think it tends to exclude the people who use the services the most poorly, the most vulnerable, people whose health is not good.
Would you point to particular places where you think there is good practice? It doesn't have to be perfect, but things are happening that would give cause for optimism.
Yeah, I think I would. I think an example of where I have seen that in practice would be Addenbrooke's Hospital in Cambridge. So they are headed up by a chief executive who is a doctor by background, actually, but he believes passionately in providing the service through a framework that is grounded in quality, not anything else, on the basis that good quality services will be efficient. For example, good quality services will be well used and will leave people feeling empowered to self-care when they leave and not return and not use their services too often and things like that. And for me, that example can embed the principle of quality in how you engage your staff. That you engage your staff around some key principles that are about putting quality right there, fundamental. You do it in the way that you communicate and engage through your communications, so your public messaging, through newsletters, through posters, through the things that you put up around your buildings. You do it through creating a nice environment for people to go into, which isn't full of lots of wordy signs that make people get lost. You do it through fundamentally finding out what people think on a systematic and regular basis. They run a programme where every month they survey, I can't remember now, but some huge amount of patients that have just left. So all the time they are finding out and seeking feedback. How did we do? What was it like? Did it work for you? What could have been different? And then they use that as a way to create a benchmark, and then they can manage and monitor. And in fact that allows them to be able to see ward by ward, doctor by doctor, where they have peaks and troughs, where they've got issues. So instead of focusing it on how much money have we spent, what's the budget like, how many beds have we got available, how much time, what's the minimum amount of time we can keep somebody in this bed on that day, they're coming at it from a different point of view, which is how can we make this a high quality service which people want to use in an efficient way. They want to they care about it, whether it's the staff turning up to work, they care about it, the patients arriving, they care about it. I think they're creating an environment which is one which is about good. It's about the experience and investing in people, not investing in policies, procedures, bottom line, budgets, and the other things which can become actually much more important than people. It's not unusual to go to a meeting or to spend a day at an event or a workshop, which maybe the title of the workshop might be something like patient experience, making it work, something like that. And nobody talks about patients all day. All they talk about is, writing strategy, creating a data warehouse. I was at a meeting recently where patient experience had been distilled down to, I know what we'll do, let's make a data warehouse, because that'd be able to tell us. And I think there's
somehow misses the human element.
Yeah. And I think that's because human beings are challenging and difficult. And over my career, I've come into contact with lots of people, and I'm still amazed, but I shouldn't be, that I think a lot of people, managers, doctors, they're actually scared of people. They're scared that if they ask them the obvious question, that they won't be able to handle the answer, or that this person will tell them something that they can't deal with. And so they avoid any opportunity, avoid opportunities to actually have a meaningful conversation which places the person in a position of equal power and status.
Jessie, thanks for talking to me today.